All right, Madam Ada, I can still remember vividly in 2019 when you approached me, and you came into the office with tears, and I saw beyond the tears. Your heart was ripped apart. I stood and watched him meeting you for the first time. I could not just get my own emotions out of it. Now, can you tell our African viewers what transpired when you approached Cordial?
One, when I came in, I don't know how I managed and drove myself to his office. Yes, but when I got there, I couldn't speak.
That is true.
When it makes a child you have grown a final year student, when she told me that she knelt down to write all her final year exams, she can't sit. She will kneel down and be writing. So when I entered, number 2 is that I don't even have the money. But I have a very unique, sweet friend, Mr. Tony Omome. When I told him, he said, how much is the surgery? I said, I don't know. I didn't even make it quiet. All I was doing was crying. I said, I don't even know how much will be the surgery. I don't even have money for the tickets. He told me, he said, you know what? Let's start a step at a time. I said, there's somebody I want to go and meet at Obanikoro also. He said, just go when you get there. So when I got there, and I told James, I said, Sissy, I don't even have the money. You know the shocking part of it? He told me, say, mother, keep the money aspect aside. Let us start with the visa application. Can you fill the form? There and then, not up to 30 minutes, I entered there. He said, do you have your passport? Oh, yes. Before I spoke to you on the phone, you said, come with your passport and your daughter's passport. Do you have it? I said, yes. While he was asking me all these questions, in my mind, I said, I don't have money to pay this man. In that,
Yes, he mentioned it severally, and I ignored.
So,
Continue.
he now said, he called his secretary, say, let's start filling this form. I couldn't fill the form.
Yeah.
What happened was that they started reading the questions to me. I answered, and they were filling it. Could you believe? Is it up to 2 days?
About 3 days.
3 days. After filling the form, he got an appointment. He was asking me within 2 to 3 days which one would be convenient. We chose 2 days. The appointment day, we went there. He assisted. There's something I want to say. I went for the interview. We paid. In 2 days, they brought my visa and my daughter's visa to my house.
Exactly. That was true.
To my house. I have never seen such professionalism and favor in my whole life. That was when I knew that God's hand
Was in it.
was in it.
Yeah, sure.
And the next day, he brought the president or chairman of the Indian hospital that we went. They came.
You came here
to see me.
So
So when they came, I told them, I said, by then I was able to raise 2 million. I told them I don't have money. I have only 2 million. They said they are not interested. All they want me to, when do I want to come into India so that they will go ahead and start preparing? That their main concern is to, first of all, find out what actually is wrong with my daughter. I have never seen such grace. And that was the next, before you know it, he got us a ticket. And in less than 7 days, we were out of the zoos to India. And the most sweetest part of it, they came with bouquet of flowers.
Yes, on arrival.
On arrival.
Yeah, at the airport.
To pick up me and my daughter and took us to the hotel. I don't know.
So, our viewers, please check cordialglobetrotters.org. You will see her picture and her daughter on arrival in India in the website. Please continue, madam.
Yes. And when we got to India, the next day, we went to the hospital. When we got to the hospital, they started within 30, 40 minutes. We met the consultant, the orthopedics doctor. Then he gave us several tests to go and do. The MRI, they did the biopsy and everything. Within 4 hours, the result was out. Then he called me. He said, man, with the result they have here, that this surgery is going to be a special surgery. He said, where the tumor is very close to the tissue, which is a general surgeon that controls there. It's very close to her womb, which a gynecologist is going to be part of it. It's very close to the arteries, which a neurosurgeon will be there. Then it's the bone. The tumor has eaten all the bone
at the back.
At the back,
Yeah.
which the orthopedic surgeon
Must get it blood.
there. Then the anesthesia. So that I'm going to have 5
specialties.
So can you now understand the stupidity of Nigerian doctors? How a neurosurgeon was moving me to orthopedic surgeon, and orthopedic surgeon he said, hey, it's very close to the tissue. And the general surgeon, I felt so ashamed. But to the glory of God, they now told us that they are going to give her an injection. They gave her an injection the second day we came.
Okay.
And that injection is like a chemo that is good because the tumors scattered all over that place. So they said they will give her that injection. That what that injection is going to do is to gather. She will stay 6 weeks before they could fix a surgery date. That injection will gather all the tumor from all the area and put it in a box. So that because the artery is involved, so that when they are doing the surgery, they will not need to damage anything. I said, okay. So when they said 6 weeks, bear in mind, I went with only 2 million. All the tests we did took almost 1.3. So we had $700 left. And then I was in a hotel that we pay $50 a night. So when they told me that, I told them that was around middle of February. I told them, well, I can't stay with $700 for 6 weeks. Is it my accommodation? Is it my feeding? Or is it the surgery? We've not even thought about the surgery fee. So I called him.
Yeah.
I said, James, this is what is going on. I called my friend, the medical doctor in America. I said, Anedi, I need to start coming back to Nigeria. God bless her. You know what she told me? He said, Ada, you can't move.
It's not happening.
You can't move. Tell the hotel you're staying if they take credit card. I'm going to send you my credit card numbers and my password. Let them start debiting that credit card for the accommodation. I told the hotel, Indians, I don't know why, they don't do anything that will make, So they said they don't take credit card. So I went back I called you.
Yeah.
Then you called the African coordinator.
Yes.
So I told them I need to go. That I don't know. So they said, what's the problem? I said, I don't have money. Number one, that's 6 weeks. You know what they shook me with? They said, is that the program? I said, yes. He said, don't worry. We have a guest house. Our driver will pick you, go to the hotel, pick your things, and take you to
this guest house.
Do you know these people took me to a 3-bedroom duplex? They said, don't pay anything. Just stay there. After the surgery, we know you won't run. Anytime you have the money, you can pay. I said, God, so you pay. That was how we moved to the guest house. Guess what? 4 days after we moved to the guest house, COVID broke. They closed the airport.
Yeah.
So apparently, my daughter would have been at the grave.
In fact, she would have been gone. She would have been gone.
So that was how Indian got me. I stayed in India for 9 months. But to the glory of God, as we were there, we were still praying and everything. Within 2 weeks after they closed this thing, money started flowing into my account. 5 million will come in. This one will come in. And because of the COVID and because of the nature of her illness, that tumor has eaten all her immune system. It's low.
Yeah.
So they say we can't come to the hospital. She can't near that hospital
Because of COVID.
COVID, so that she does not, because once she, with that her level of
Weakness.
if she catches COVID, she won't make it.
Yeah.
So that was how we stayed doing nothing for another 4-5 months, until when they started gathering, suppressing the COVID thing.
Because it was a global thing. Even in India, a lot of people died. It was a global issue.
So when they started gathering, they now called me. They said, "Ma'am, I think we will fix her surgery in 3 weeks' time." And guess what? That day of the meeting, all the doctors were, consultants were involved. Every one of them that spoke, no one gave me a good news. The neurosurgeon said, in case any mistake and her artery is tampered with, she will be paralyzed for the rest of her life. The guy said, in case any mistake and we tamper with her one, she cannot give birth. The orthopedic, he said we need to do bone crafting. We need to come to her knee, get bone from her knee and fill up. Before we traveled, I didn't share this. Before we traveled, because the tumor has eaten all the bone in her bum, I don't know, the pelvic, yes. So my daughter became so lame. She just stopped eating. Because once she eats, because of that bone that the tumor has eaten, as she eats, the food comes out immediately. No controls, nothing they hold the pelvic again. So if she eats, she can't leave the house, because as she's finishing putting the food in her, she's going to the toilets to bring it out. So that was the situation we found ourselves. So when they now gave me all those reports, this was how I was looking at all of it. From that moment they gave me that report and they gave us 2 to 3 weeks to the surgery, I couldn't sleep. I developed palpitation. I don't sleep. If I lie down on the bed, my heart will be beating. I was wondering, because everything they said was that it is a dangerous move.
Yeah. Very sensitive surgery.
Very sensitive surgery. So what I did, I started praying. Even I had to go to the hospital. I told them I need sleeping tablets because I can't sleep. If I don't take sleeping tablets, I can't sleep. Until we kept on praying. We were there, we heard the pastors, we were all praying. Then, God, a week to the surgery, the doctor called me. He said, "Man, this is my 28 years of doing surgery. And I have, for that 28 years, what my daughter was suffering from, I didn't share when they did the biopsy. Giant cell tumor. A very uncommon tumor that feeds on bone, blood, and sugar." And Dr. Prave said, for his 28 years of surgery, he has never operated on a giant cell tumor. So after they had that meeting with me, that he has not had peace, that he has been calling all his colleagues from Germany, from America, from Dubai.
I think I even spoke with him then in that 2019 or 2020, and he mentioned that not only was this the tumor giant and unique, that the positioning too, it's the worst. Where the tumor was, they also called me over her case while she was there. They said, "Look, Mr. James, this is crazy sensitive. 5 specialist doctors, different specialties, must be involved in one person. And they have to pull the best of the bed. And this is something that cannot happen in Nigeria, by the way. One doctor sees to orthopedic, sees to uro, sees to oncology and all that. But there, you see several specialist doctors in just one case. That tumor was in a position that the doctor could not sleep. So you continue, Madam Ada.
Yes, he said he could not sleep, that he's so worried and he doesn't want to make mistake. I said, okay. He said, ma'am, you know what? I want you to come with baby to the hospital. They call it high baby.
Yeah.
We need to do, after I spoke to two of my colleagues from Germany, there is a test they suggested I must do before we go in, so that my doctor should come and do the test. But he said, but when you are coming, get some things. You might sleep over. Professionalism, you see, on top notch. Yeah. Apart from that, they are medical practitioners. They also know how to handle the emotions of you understand? Yeah, so that was how we came, and they call it contra scan.
Okay.
Yes. So they injected an injection in her artery.
Okay.
I don't know what the fluid they injected, and pushed her into the scanning machine. She was in that scanning machine for over 30 minutes.
Was she conscious?
Yes, she was. Yes, she was. So over 30 minutes. So when we came out, they gave us a room upstairs. So that was where we are, thinking we were going back. Only by 5 a.m., a nurse came and knocked on my door. He said, Mom, prepare baby for surgery. I said, prepare baby. I said, okay. I woke her up. She got ready. We moved. So when we got there, the whole doctors were there. Then they took her in. That was how I called one of the doctors. I said, please, you need to be sedated. I need to sleep. Because all my body was shaking. I said, I can't stand it. He said, okay, they gave me tablets. So I went to the room and I dozed off. I was sleepy. I asked them, how many hours is the surgery? They said about 4 to 5 hours. I said, okay. I never knew I slept for more than 7 hours.
Wow.
It was the call that woke me. They called me. Say, man, come, the doctors want to see you. I might know.
Sorry.
I said, I dressed up. I went there. When I got there, it was during COVID time. All the doctors
who cover their nose, in face.
So they sat in the conference room. So when I entered, all I could see was their eyes. And their eyes were just speechless. I will look at this wall. I will look at this wall. I will look at this wall. For good 5 minutes that I entered there, none of them made a speech. I was just sitting there. I look. I just, maybe I leave Dr. Prave.
Yeah.
Just removed his own mask and smiled. I jumped up and held him.
Yeah.
He said, well, so far so good. I think we did a good job. But she's in a recovery room. Once she wakes up, we have to move her to to do another X-ray. They need to have a look at what they did, I think, to the lab. But he told me, he said, you know one thing? He now sent me the result of that ultra scan we did. You know this code? That ultra scan, it's inside that ultra scan.
Yeah.
There is red line. All the arteries turned red.
Okay. So
where the arteries are. And the unique part, all the tumor, the arteries were up. All the tumor was down. So they didn't have any reason to tamper with any arteries. So they went down there and scooped the much they could. They couldn't. He told me they can't take all. Yes, but they took majority chunk of it, and that was it. So by the time they brought out my daughter, we moved her to the lab, and she did X-ray, she did MRI, she did all the tests, and Dr. Private said everything looked so perfect. Let's wait for her to make her first poo and gas. Then see if she can move her legs. And did you know the unique thing? Why your teen is fantastic. The doctors called me when he came to see her a day after. And they brought the physiotherapist to see if she could move her leg. A day after she used the toilet, so Dr. Private said, good. Then it's for gas. So when she gasped, they said, fine. Then the physio tried to tell her to move and she moved. You know what Dr. Private told me? He said, ma'am. No, before we went in, he said, ma'am, try and see how to control calling on the nurses. Because each press button you press, everything is automatic, girl. Yes. The card, the number, everything is linked to each other. So in that room that she is now, it has been clipped to her bill. So each bell you press, each doctor that comes and say, what can I do for you? You pay for it. So and he also said, I think she's doing well. After 2-3 days, I will discharge her. You start coming. You see how
Dr. Private told you this? Wow.
You see how kind. He said, if you are by international patients, so that they feel so sorry.
Because he's pay more.
Yeah, we pay more. But that the way he sees me, that I shouldn't worry. That was what Dr. Private did. And that was how we went. And before you know it, 2 weeks, the wound started closing up. All of a sudden, I don't know what happened. The wound started decay. By the time we maybe made some call that and they put mucus extractor, okay, and he was sucking it. But the unique part of it is that we were in India and were treated like prince and princesses.
Yeah. That's what we do for international patients.
Pay.
Something you cannot get at home. At least you should get it.
From the driver, the house they gave me, I have a cleaner. The cleaner comes in the morning, sweeps, mops. If I need any assistance in cooking, they will do it. I have never seen such in my whole life.
Was there any time you were psychologically put down like the nurses would do here in Nigeria?
How the way they see you, they see you as a god. They see you that without you, I will not be paid. They see you that you come first. They see you that you're a priority. Both from the doctors, the nurses, is it the transporter? From the moment your transporter ordinarily opened or closed, the moment you come down from the car, they come to open the door for you. Before you know it, they move the chair, the wheelchair. They help you inside. Man, is there anything you want? Do you want this? The training is from up
To down.
to down.
Now, let me ask you, Damada. This practice in Nigeria of you go to the hospital, you take a test, the doctor asks you to go take a certain test, refers you to a given lab, and then when you come back, whatever the doctors do, they usually do not hand over copies of the files or our local patients to them. Is it the same practice when you went for this?
When I came back, I have a platform which is called Medical Police. When I came back, maybe I will share the video with you for you to. I make a video. And what did I make? Who does the file belong
Belong to. Very important.
I have it on my page. Who does the file belong to? It is only in Nigeria you will come. I will go to the hospital. You will give me drugs. You will remove the name of the drugs. If I have a side effect and I go to another hospital and they ask me which medication did they give you, I'll be saying now that one where get yellow, get blue, get purple.
No paper to show.
When you go to, do you know when I go to Lutz, when my daughter was there, and doctors, and I will pick the file, and I want to read what is there, a nurse will walk up to me and snatch
it. They don't want you to, your own documents. You should, in fact, this is what CCTV will be doing. We're going to be educating you on your rights. If you take a test in a hospital, those files belong to the patient, and then they can have a copy.
You know the hospital, let me tell you how it works with them. They have a system. Everything is keyed into the system. The paper file belongs to you. They already have everything digital in their system.
And if they don't, they try to make copy for themselves. But you see your file? How big was the file you came back with?
Is it the X-rays? The file is as big. The weight of the lead on. Everything you do, you have a file. Each time you see the doctor, you have a new folder. Each time you see the doctor, they give you a new folder. Because doctors differ. You might see, like when I was waiting for my daughter to get well, I had to do a general
body check.
So after the general, they looked at it, they said, you have an ovarian cyst. It's large. Normally, ovarian cysts should be 3 point something, for mine was 9. And my own has grown so big that it has grown teeth and hairs.
Wow.
Yes, I did the surgery in India.
You need to tell me about it.
My ovarian cyst has grown.
Oh, sorry. Yes, a doctor mentioned it to me.
You see why some people will say sudden illness?
Yeah.
That thing, immediately they finished it. The guy, he said, no, with what I'm saying here, I am moving you to the theater. I don't need anything. I don't need any confirmation from you. I am moving this.
Because it was now very dangerous.
They said, I now asked her, why did I now feel that I have that this ovarian cyst is large? So she asked me, what question she asked me? She said, how often do you make love? So when she asked me, because I was wondering why I should have such a dangerous with teeth and hairs, and I didn't finish. She asked me, how often do you make love? I said, not really. For a long time, I've not. He said, that's why. That if I was making love often, the sex would be very painful.
You would have started feeling things wrong.
Yes, I would have started feeling it. But because of that is why I'm not feeling. So I now asked her, he said, if I didn't remove it, they removed one of my ovaries. He said, if I didn't remove it, in the next 1 or 2 years, it can turn to cancer of the uterus.
Wow.
2 things. He said either it turns to cancer of the uterus or it will explode, then I will bleed to death. Because once it starts, the bleeding won't stop.
Will stop. It's a cyst now.
So that was what she didn't even ask for my consent. She said she's brain.
Yeah.
That was how she removed it. You see? So we have a number.
Yeah, you've got quite an experience, and that's why it is important that you share with our viewers who are not knowledgeable in so many of these things. Cordial Compact TV will be shooting this information, this knowledge, travel knowledge, medical tourism knowledge to our viewers, so that those who ordinarily shouldn't die should be made to stay alive via education.
So another thing I found out from my comprehensive check, why you should boost the essence of comprehensive check.
Yeah.
From that same test,
Okay.
I found out because when I left, I felt I was hypertensive because I went to America. I was very sick. So they said I was hypertensive and gave me hypertension drug. So I took it. That was in 2019. Only for me to get to India. So when they did the test, their well tests, I went through the treadmill and all sorts. Then the doctor asked me, because they asked me if I have hypertension. I said, are you on hypertension? I said, yes. He said, who told you are hypertensive? I said, it's my doctor. He said, no, they're not. With the treadmill, with your activities in the treadmill and your heartbeat, you are not. There are different types of hypertension. It's simple. Problem-induced hypertension, hereditary. He now asked me, did I have I said, yes. In 2019, that's Oluchi's illness. So the whole thing, I was nervous and also. So it's a problem-induced hypertension.
So it was not real hypertension.
Yeah, so by right, in 6 to 3 months of that medication, it will go. It would have normalized. Then I also found out that I had high cholesterol. Okay. So I now asked him, which medication do I take? He said, no, you can't take any medication. I said, why? He said, because the side effects of cholesterol drugs is worse than the cholesterol.
So it's
that it destroys a lot of organs. That's the only thing I can do is lifestyle.
good.
I should exercise more. I should stop taking oily fried food. Just lifestyle.
And I enjoy your dance, a lot of your dance.